Hi, everyone. Hi, Mrs. Whitney. Thank you so much for being here. I really enjoyed getting to know your daughter. She's a really motivated young girl. She appears to be alert. She has an appropriate attention span. The assessments that I completed with her were pretty long, so she did a really great job with that. And she can complete age-appropriate occupational activities for things like education and social and leisure participation. So her visual perception and just overall visual skills appear to be intact, and she doesn't have any deficits regarding being able to scan for things, identifying objects in different environments, things like that. So, but while spending time with Olivia, I noticed that she struggles with gross motor tasks, things like motor planning and just overall motor control. So this could be a reason why she fatigues really easily, and she reports she doesn't like gym class. So because Olivia is so motivated to succeed, there's a couple goals that I want to talk about just to improve her gross motor skills.
All right. So overall, we would like to use the strengths that Olivia has, especially in the motor, in her visual scanning ability and her visual abilities, as well as play into some of those areas of improvement for gross and fine motor. So we first want to start looking at occupations or everyday activities that Olivia participates in already, and those would be in gym class or in recess. So the first goal will be Olivia will participate in gym class for 30 minutes with minimal breaks, and we're hoping to look at this for twice a week within 6 weeks. We will be collaborating with the gym teacher and having some sort of measurement tool so we can have documentation as well as weekly meetings to have a conversation about the appropriateness of this goal for Olivia as she progresses throughout therapy. The second one will be Olivia will participate in gross motor activities during now recess instead of just gym class that require bilateral coordination, but we want to look at upper body and lower body and how they play together. The purpose of this goal will be to increase proprioception and kinesthesia. So where is Olivia's body in space when she's sitting still or static versus when she's moving? So for this goal, we'll look at 30 minutes for 1 week within 6 weeks. Again, the same setup that we would have for the gym teacher will be we will collaborate with her main teacher, her homeroom teacher, to have her to have a measurement tool. We can write out the activity she did participate in and then collaborate on the appropriateness of the goal as she's progressing through therapy. So then overall, the benchmarks or the objectives for Olivia. So to achieve these goals, I want to collaborate with Olivia specifically to find activities that she really does enjoy that focus on body structure and body functions that will require her to build those skills in those physical areas that she can apply throughout recess, gym, and other gross motor activities that she does participate in. So I'm going to focus on bilateral coordination, hand-eye coordination, and movement that requires upper and body tasks being put together. So basically throwing a ball and stepping at the same time, such as or kickball when a ball is coming at her and she has to kick it, or even tennis where she has something in her hand and she needs to find out where her body is in space with that tool with an object coming at her. So we will make sure to create these activities and allow for breaks because Olivia is very, she shows that she can emotionally regulate very appropriately. And we would like her to continue to use those skills while she's learning the new activities.